Today we'll discuss the drug Gabapentin, which comes under the brand name like Gabator or Gabapin, 300 milligram. So this Gabapentin, it's a newer antiepileptic which is introduced after 1990s, which comes in 90s. So this Gabapentin originally it is developed as a spasmolytic and later on found to be effective as an anticonvulsant. Gabapentin, which is a newer antiepileptic introduced after 1990s. Originally it was developed as a spasmolytic, antispasmodic, and but later on it was found to be effective as a anticonvulsant drug. So this gabapentin, by mechanism, it's a GABA analog. So it increases GABA concentration by affecting the GABA metabolism. Its non-synaptic release and its reuptake by the GABA transporter. There is a non-synaptic release and its reuptake by the or through GABA transporter, but it does not act on the GABA A receptor. Though it is a GABA analog, gabapentin. That's why the name is gabapentin, GABA analog. That's why the name is gabapentin. So it increases GABA concentration by affecting the GABA metabolism. Its non-synaptic release and its reuptake occurs through the GABA transporter, but it does not act on the GABA receptor. There is action on the calcium channels. Gabapentin binds with the alpha-2 receptor or alpha-2 subunit of the voltage-gated calcium channel. Where it binds to the alpha-2 S subunit of the voltage-gated calcium channel. That reduces the calcium entry, and that's how it reduces the synaptic release. of the glutamate, which is an excitatory neurotransmitter, and that's how it exerts its anticonvulsant action. What is the action on the calcium channel? Gabapentin binds with the alpha-2 S subunit of the voltage-gated calcium channel. When it binds to this calcium channel, it reduces the calcium entry, and when it reduces the calcium entry, it reduces the synaptic release of glutamate, which is a excitatory neurotransmitter, and that is the what we can say it contribute for its anticonvulsant effect. Pharmacokinetic properties: neither it is metabolized in the body and nor it is an enzyme inducer. It is not metabolized in the body and it is not an enzyme inducer. When it is given orally, oral bioavailability is 50%. It does not bind to the plasma protein. It will get excreted unchanged in the urine. It does not bind to the plasma protein. It will get excreted unchanged in the urine. So it can safely combine with the enzyme inducers like antiepileptics, like phenytoin and phenobarbital. Because it is not an enzyme inducer or it is not metabolized in the body, so we can easily combine or safely combine with the other enzyme inducer antiepileptics or phenytoin or phenobarbital. And it can be used in hepatic dysfunction or hepatic failure patients because it is not metabolized in the body and it will get excreted unchanged in the urine. Now, where it is used? This gabapentin is used for the partial seizures and generalized tonic-clonic seizure. It is used for the partial seizures and generalized tonic-clonic seizure, but as an adjuvant, not as an drug of choice. You can use as an adjuvant in case of partial seizures or generalized tonic-clonic seizure. It is also effective for the neuropathic pain. And post-herpetic neuralgia. It relieves the acute muscle spasm because it was developed as a spasmolytic, antispasmodic drug. So you can use in cases of acute muscle spasm, post-herpetic neuralgia, or in case of diabetic neuropathic pain. But you can use as an adjuvant drug for the partial seizures or in case of generalized tonic-clonic seizure. Adverse effects or side effects like sedation, there is a headache, dizziness, ataxia and tremors. These are the side effects or adverse effect. Dose is very important. 300 milligram OD orally when it is started initially 300 milligram orally once daily, or you can increase the dose up to 1800 milligram per day in 3 divided doses. You can increase up to 1800 milligram per day, but initially you have to start with the 300 milligram OD. Brand names which comes under like Gabapin, Gabapentin, Gabagesic, Pentanor, Progaba, Larigab, Gabator. These are the various brand name which is present in the clinical market. Which is this Gabapin is available as a 100 milligram, 300 milligram, 400 milligram, and 450 milligram slow release tablet or sustained release tablet. These are the various brand name. Now there is one more congener, that is the Pregabalin. This Pregabalin, it's a GABA analog, or we can say it's a Gabapentin congener. What is Pregabalin? It's a GABA analog, or it's a Gabapentin congener, and it is most commonly used or drug of choice for the painful diabetic neuropathy. Pregabalin is a drug of choice for the painful diabetic neuropathy. It will act similarly like gabapentin. It acts by increasing the GABA concentration in the brain. Mechanism of action is almost similar to the gabapentin. It acts by increasing the GABA concentration in the brain. The dose is 150 to 600 milligram orally, and it is very well absorbed when it is given orally. Oral bioavailability is almost 70%. Half-life is 7 to 8 hours. There is no plasma protein binding. It is not metabolized in the body, same like gabapentin, right? And it is used in cases as an adjuvant for partial seizures, generalized tonic-clonic seizure, same like gabapentin. It's a gabapentin congener, newer drug. It's a GABA analog, newer drug, and it's a drug of choice for the painful diabetic neuropathy, right? And it is also used in case of the restless leg syndrome, spinal cord injury, post-herpetic neuralgia, and neuropathic pain which is associated with the diabetic mellitus, or you can say painful diabetic neuropathy. It is most commonly used drug nowadays, Pregabalin, which is nothing but a gabapentin congener or GABA analog. Mechanism of action is almost similar. Pharmacokinetic properties like oral bioavailability 70%, half-life is 7 to 8 hours. It is not metabolized, there is no plasma protein binding, and uses almost similar like gabapentin. So this pregabalin and gabapentin, these are the newer antiepileptic, and they are used in other cases like neuropathic pain, post-herpetic neuralgia, and it also relieves the acute muscle spasm also. So this is all about the gabapentin and pregabalin.